With that said, thank you all for coming today. My name is Travis Giffen. I am the Assistant Director of Online Programs at the College of Education at the University of Illinois. I want to thank you all for coming to our information session today on the Trauma-Informed Education Certificate of Specialization. It is long, but it is great. So thank you all for coming today and making the time to be with us all. Just to give everybody a quick overview of today, after I finish up, I'm going to turn things over to faculty from the program and others here from the university. Myself will be in the chat, as well as another staff member, Gina Poff, will also be in the chat. And Sangeetha may also join us and help answer questions about registration and tuition or things like that that happen in that may come up through the presentation. Other questions, we will have time at the end. After others are done, I'll come back and just briefly show you how you can register for courses when our registration opens up on July 13th to share that. And then we will have Q&A time where you can raise your hand and unmute yourself and ask a question or type it in the chat, and I'll read that question off for y'all. So without further ado, I want to hand things over.
Great, thank you so much, Travis. We're so happy to be here. Welcome. We're going to talk to you about one of our newest programs here in the Department of Special Education. But first, we wanted to start by talking a little bit and telling you a little bit about who we are. So I will start. I'm Dr. Catherine Kaur. I'm an associate professor in the Department of Special Education. And my area of research or interest is how we support young kids with disabilities who've experienced abuse and neglect. And previously, I was an early intervention provider in the state of Illinois and also a preschool teacher. So I see a lot of early childhood folks in the chat, so it's good to see you all. I'm going to pass it over to Mickey. Do you want to introduce yourself?
Sure. Hi, everybody. Thanks for joining us. I'm Mickey Ostrowski. I'm on faculty at the University of Illinois also, have been here for 30 plus years. So back in the day, I taught individuals who had pretty significant disabilities. And my area of interest is really around social emotional competence and challenging behavior. I'm particularly interested in peer relationships and attitudes of how children how we create accepting communities in classrooms so that all children are accepted and their families. So I'll pass it on to Jessica.
Hi, everyone. I'm Jessica Hardy. I'm an assistant professor in special education. My research revolves around understanding evidence-based instructional practices, particularly for teaching social emotional skills and also early math skills. And I've just finished my third year at the university. I'm also the coordinator of the Early Childhood Special Education Master's Program. So thank you all for joining us. And I will pass it to Mia.
Hi, everyone. I'm Mia Chudzik. I'm a doctoral student in special education. My research focuses on trauma-informed care in early childhood special education settings and helping prepare professionals to implement trauma-informed care. I received my bachelor's and master's degree here from the College of Ed, and I did the trauma certificate as part of my master's program.
Great, thanks, Mia. So let me tell you a little bit about what we had planned for today. First of all, on the right, you're going to see a cartoon that is an elephant sitting in a chair talking to a therapist, likely. And it says, "I'm right here in the room and no one even acknowledges me." And so this cartoon makes us think a little bit about trauma and how we are or are not acknowledging trauma in our everyday work. So I like to use this a lot with our students because oftentimes they will say things about the trauma experiences they're seeing in their classrooms, but they're not necessarily addressing it meaningfully. So that actually led us to developing this program. So today we're going to talk about why trauma-informed education is important. We're going to talk a little bit about the overview of the actual certificate of specialization. And then Mia is going to share a little bit about her personal experience. And then we'll share time for questions and answers. Feel free throughout the presentation to drop questions or comments in the chat. Travis is going to help us keep an eye on those during the presentation. So why trauma-informed education? Is there really a need for this? So lots of you, maybe this is probably the wrong group to sell this to. You probably already believe in this, but in our work, we oftentimes think about creating inclusive, supportive environments for kiddos. And recently, there's been a lot of attention thinking about trauma, especially with the pandemic. And so the rationale for us sort of thinking about creating this program is that there's a lot of research that's been done around trauma and how it impacts development. So over 60% of adults report experiencing at least one potentially traumatic event in their lifetime. So we know that this is common. In a class of 20 students, you will oftentimes see that at least 12 have experienced a potentially traumatic experience. For us in special education, there's a real connection between trauma and disability. So we're constantly thinking about how we are supporting kids who have disabilities and what that looks like, since they're oftentimes more likely to have experienced trauma. We know that students have better outcomes, both educationally and socially, when they receive trauma-informed care, but that doesn't always happen. And then finally, all students can really benefit from trauma-informed care. So we don't necessarily have to find one kiddo in the class who's experienced trauma and just try and intervene on that one kiddo. There's really great practices that happen in trauma-informed care that can be used for students across the board. And I'll actually share that this isn't just a K-12 approach either. So I've been trying to think about how trauma-informed care approaches map onto my university instruction as well. So it doesn't stop with kids in the elementary classroom. So that was sort of our rationale for developing this program, is that we work a lot with teacher prep and thinking about getting students prepared to go out and work with young kids with disabilities. And trauma was a huge piece of that was sort of going unnoticed or untalked about. So we're going to give you a little overview of the certificate program. So I'm going to pass it over, I believe, to Mickey, who's going to talk a little bit about the purpose of the certificate.
Yeah, so we started this program and really thinking, first it was Catherine and I and Brenda Lindsay, who's in social work. We started with a grant, really thinking about trauma and what did we hope that our students would gain from learning more about trauma-informed supports and care. And then the more we talked about it, the more we had students involved in this interdisciplinary program, the more we thought more broader groups, more individuals might be interested in learning some of the strategies and really thinking about trauma and how trauma impacts individuals. So our goal is that by having this certificate, others can access this program and educational professionals can really learn about how they can meet the needs of both children and their families who have experienced trauma. So by the time you're done with the program, what we hope is that individuals or participants will be able to really look at how does trauma impact child development. So what happens to children? What's the impact when they experience trauma? And look at that. Catherine mentioned a little bit about the relationship between trauma and disability, that individuals who have disabilities tend to or have experienced, the research has shown that they've experienced higher rates of traumatic experiences. So looking at that complex relationship between trauma and disability. Thinking also about how to modify learning environments. So looking at the role of schools, communities, homes, so that you can become trauma-informed and look at children's behavior through a trauma-informed lens. Also, Catherine mentioned a little bit about kind of self-care and thinking about not only children and families, but ourselves too as professionals. How can we facilitate self-care and reflection in everyday practices? So how can we step back? How can we help children and their families learn how to take care of themselves and reflect on things that are happening? But also how can we as professionals take on that role? And then finally, to think about practical solutions through research, through designing and developing solutions to issues that come up around trauma in education. So what kind of questions are we curious about related to trauma? How might we develop some projects around that to answer some of those questions we have around the impact of trauma and young children and their families. So I will pass it on now.
Great, thanks, Mickey. So I'm just going to quickly say that I saw a question in the chat asking, is trauma-informed care solely applicable for students in special education? And I would say, no, it's not just for kids in special education, but it certainly can benefit kids who are in special education. So it can really benefit all kids. We sort of take this approach that it could be beneficial from preschool all the way up to college. So you don't have to have kids with disabilities in order for this to be a useful approach to your work. So I'm going to tell you a little bit about the classes that are involved in the certificate. The classes start this fall in 2022. Travis will give you a little information about how you register and things like that. But let me tell you a little bit about what you'll actually cover in terms of the content. So we have a class called Individual Differences, which is all about the impact of trauma and what that looks like in terms of child development. So learning what child development milestones are, what they look like, how you support those in classrooms, and then also realizing and recognizing how trauma impacts those milestones, and then what you can do as an educator to support kids. So that is one class. The second class is probably, I would say, most students' favorite class. It's what we call our trauma seminar. It is run by a graduate of our program who was a practicing social worker and now has her PhD in special education. And it's an interdisciplinary seminar that focuses on implementing trauma-informed care. So in this seminar, folks will read different books. They will come prepared to sort of discuss different case scenarios, to reflect on their practices. And it's a chance for folks to really unpack their actual teaching. So, okay, I read about this trauma-informed practice. Here's what it's supposed to look like, but it's not really looking like that in my actual practice. So this is a really great place for folks to problem solve, to get some community support, and to also do a little self-care and reflection in their own practice. We call it interdisciplinary because right now we have students from social work and special education who are part of the seminar. And then obviously when the certificate begins from the chat, we have folks all across different disciplines. So it will continue to be an interdisciplinary network. The other nice thing about this class is that folks get to informally learn about different disciplines. So we found that our special ed students oftentimes didn't necessarily know what a social worker was responsible for, what they actually did in terms of their day-to-day work in a school. But because of this trauma-informed seminar, they had opportunities to really unpack their day-to-day responsibilities, and they oftentimes leave having a greater network of folks when they graduate the program. The final class is something that we called a field study, which Mickey kind of alluded to in the last slide. We think it's really important that not only do we give folks the opportunity to learn about what trauma is and how it impacts kids, but that we also give folks the skills to research problems in their own practice. And so this class will help you sort of take that lens into your own work. So you'll identify a problem of practice that's related to trauma-informed care in your own practice. And then we'll sort of research solutions to that problem. And so this is a really hands-on class. It extends, you can see it's 6 hours, so it extends across 2 semesters. But it's a great way for you to sort of examine your own practice and take a problem-solving lens to the work that you see in your everyday practice. So in this class, there's very different approaches to what types of problems are being looked at. So I'll have Mia talk a little bit about that from her experience. But just know that it's very personalized. So if you are an administrator working in a building, you will have a chance to design a study that looks at problems that you see on a day-to-day basis. So we really try and tailor it to your interests and to your everyday practice. So I'm going to turn it over to Jessica, who's going to talk a little bit about the benefits of becoming trauma-informed.
So the main benefit we see is that becoming trauma-informed gives you a new lens that helps you understand the students of whatever age you're working with, and potentially their families better. So you're understanding, you're taking a more holistic view of students and their development and the experiences they're having in your setting. What this looks like practically is you being able to more effectively support the children, the students, the families that you work with, including helping them, helping you build stronger relationships with them. So when you understand the impact that potentially traumatizing events has played in their lives, then you can be more intentional about how you build relationships with them. It can certainly help you support their social emotional development, because trauma is kind of inextricably related to that developmental domain. Understanding trauma can help you have a better understanding of challenging behavior that you might be addressing in your setting. So for example, if you have a child who has experienced trauma then that's an important information for you to know when you're thinking about designing interventions to help prevent that challenging behavior and address the challenging behavior when it occurs. You do not want to disregard the impact that that might have on their challenging behavior. It can also help you partner with families more effectively, build relationships with them, and partner with them in helping them get their needs, get their children's or their students' needs met. And then finally, we think that this program and becoming trauma-informed in general helps you better partner with other professionals. This is largely due to the interdisciplinary nature of many of the classes that you're going to be experiencing and learning about what trauma looks like from a variety of perspectives and how different professionals all have a piece of understanding and addressing and supporting students or children who have experienced trauma. And then the final reason that is very pragmatic one, that if you demonstrate expertise in trauma-informed education, this is potentially very beneficial to you to helping communicate your skill set to employers or potential employers when you are perhaps looking for a job. So we think that becoming trauma-informed has a real impact on the students you serve, but certainly also on on your own professional development and career trajectory.
Awesome. Thanks, Jessica. Just really quickly, a couple of questions that have popped up in the chat. One person asked if you have to be a practicing teacher or in a classroom. You do not. So also, you don't have to be in education. I will say that most of our coursework is revolved and content heavy around education, but you do not have to be a teacher in a program in order to enroll in the program. Another question that I saw was, can we sort of research how teachers might create trauma in classrooms? Absolutely. So one of the reasons we started this program is to make sure that teachers are not creating trauma in schools and classrooms, but that certainly can be an issue. So I think Lisa had that question. That certainly can be something that you focus on in your interest in the field study class. So I'm going to turn it over to Mia, who's going to talk a little bit about her previous experience in the program. We asked her to be honest with you all and share her experiences. So she's going to talk a little bit about what it was like to take the courses, graduate the program, leave the program, and share all the ins and outs of the program. So Mia, I'll turn it over to you.
Sounds good. So before I started this program, I came right from my bachelor's degree into my master's. So I did not have much experience with trauma. I had noticed from just working with kids growing up and from student teaching and things like that, that things that happened outside of school impacted a child in school. And I saw teachers handle that different ways. You know, some teachers understood that and accommodated for that, but some teachers kind of took the approach of, oh, well, you're in school now, so what happened outside of school doesn't matter. And that really kind of sparked my interest in this and led me to start the master's program in early childhood special ed, where I completed the certificate. I would say some of the best parts of completing this program are really the amount of knowledge that I gained related to trauma. I learned a lot about, you know, not only what trauma is and what can be potentially traumatic, but how it specifically impacts child development and how it can impact children's behaviors in the classroom. And I also feel like I learned really specific strategies that I could be able to implement in my classroom. So I walked away with knowledge, but also like practical things that I could implement when I started teaching. I also really enjoyed the field study course that Catherine touched on earlier. I was the only early childhood person in that class at the time, so it was nice for me to be able to hear research from people outside of early childhood and see how they were doing research, but also I got to pick a topic that I was really interested in. So I chose to focus on preschool special education teachers and their trauma-informed attitudes and practices in their classroom and kind of look at the relationship between those two. But it really is a very flexible class in the way that you can choose what you want to research and how you go about learning about that topic more and how you learn more about bringing research to practice and things like that. And I also really enjoyed the interdisciplinary nature of the program. Like Catherine and Mickey and Jessica talked about, it's combined with special educators and school social workers. And so I was in classes with people who were going to be different professions and collaborating with them. And this was really helpful when I started my job as a teacher, because that's kind of the nature of implementing trauma-informed care, is it requires interdisciplinary work. And so I felt comfortable working and reaching out to the social workers in my school, because I knew that is what I needed to do to support these students. The program really shaped my teaching because it helped kind of reinforce things that I had learned before from my undergrad and early childhood education. You know, a big part of early childhood education is the importance of social emotional learning and building relationships with students and families. But this program really explained why that's important, specifically to make it trauma informed. So it's taking what I already knew and making it more purposefully related to trauma informed care. And it also really helped me do more self-reflection related to my teaching and what I think is important in my classroom, because what I might think may be traumatic might not be traumatic for some of my students, or what I might view as challenging behavior might not be challenging for the students and the families that I was working with. So it really pushed me to be more reflective, and that improved my teaching overall. And then Jessica touched on this when she was talking about the benefits of being trauma-informed. It really changed how I view behavior in students. You know, I didn't just think about what happened right before, what happened right after that behavior. When I thought about how to help students, I really thought about, well, what could have happened 2 weeks ago or 2 years ago that was like triggering this behavior. So it really gave me like a new lens on how I'm viewing young children and behaviors that they display. And then finally, I graduated from this program in the middle of the pandemic in May of 2020. So when I was on the job market, schools had just finished wrapping up remote learning for the first time, and were trying to figure out what their new normal was going to be and what the fall was going to look like. So when I talked about my experience with trauma-informed care, I think that really piqued people's interest, because they were starting to recognize the trauma that endured from the pandemic that was impacting students and families, but even like the teachers and the administrators themselves were starting to feel the effects of it. And so it was something that they're really interested in. And when I did start teaching as a blended preschool teacher, I found that a lot of people hadn't really heard of the term trauma-informed or trauma-informed care before, but everyone seemed interested in it. And so I had these resources that I could share. I was able to help start these conversations around a topic that I think is really growing in the field of education and outside of education. And while it was impossible to feel fully prepared to teach preschool during a pandemic, this program definitely helped give me some tools and strategies to feel more prepared to support students and families during this challenging time.
Great, thanks, Mia. So we have built in some time to answer some questions from you all, and I've seen some in the chat, so I'm going to try and address them that I've seen. One was from La Passion, and I think Jennifer had a similar question or was interested in the answer, which is around thinking about diverse forms of trauma. She's saying that she's seen here at UIUC that trauma experienced by non-white students is not often respected or acknowledged or taken seriously. She wants to know how to advocate for non-white students who experience unique traumas. That's such an important question. I would say throughout all of these classes, we are constantly thinking about equity, diversity, and inclusion, and not as just buzzwords. So a lot of our practice or a lot of our curriculum is really deconstructing some of the ways that we've traditionally thought of behavior. So I would say, for example, in early childhood, we teach folks to sort of think about trauma-informed approaches to understanding child behavior, whereas we used to maybe assume that a child was disruptive or had needed supports in social emotional learning. We're trying to take a more trauma-informed lens. So I think that that is a huge piece of the program. I think we definitely talk about diversity, we definitely talk about equity, but more importantly, we really challenge students to reflect on their own practice, and we challenge students to rethink things that they've previously learned that maybe came from a very predominantly white aspect in terms of thinking about typical student behavior that you would assume to see in a classroom. So I don't know if Jessica or Mickey or Mia want to add to that at all.
The only thing I would add that I was thinking of is the individualized nature of how trauma impacts somebody. It plays an important role in how we think about trauma. That, sometimes we'll hear people say, well, all 4 kids in that family, grew up in the same kind of community or environment or had exposure to X, but those 3 turned out differently. And that the individual nature of how things impact an individual person and what you bring to that, your temperament, your personality, all of that, all the other variables that come into that, that would be the only other thing I would add.
I guess I would add, I don't actually teach the courses that we've talked about that are part of specifically the trauma certificate, but I would say in the courses that I teach, and I think also in these courses, we really try to take a critical lens and apply that to all of our coursework. So not just talking about, so kind of interrogating how we think about families, how we think about communities, how we have been socialized to view education or kind of appropriate ways of interacting in classrooms, for example. And I think that those are important conversations that we have to have and are kind of part of the curriculum, but they're also part of what students bring to different classes, right? And by students, I mean college students, not young children, is bringing kind of their understandings and their questions and their viewpoints so that we can have really rich discussion. So me and I taught a class this past fall, where students were bringing lots of excellent questions about diversity, equity, and inclusion that maybe some of which we had planned to talk about and some of which were kind of new things that we hadn't planned to talk about, and that really enriched the class experiences. So I think throughout all of our courses, including these, we try to really be responsive to what students are bringing to the table and also have this critical lens in addition to the trauma-informed lens that I already mentioned.
Yeah, and I'll just share one more thought is that oftentimes there's been a discussion around trauma, thinking about sort of zoning in and honing in on sort of individuals and have they experienced trauma? What's their ACE score? In this program, not that we don't think that adverse childhood experiences are important, you will learn about those, but we sort of take that individual approach and sort of ask folks to intervene, not necessarily at the individual level. So we'll have folks think about, what am I doing in my own classroom to create a supportive environment instead of a potentially traumatic environment for kiddos. And so that really requires us looking at practices that we've used for 20 years that have worked for 90% of students, but aren't working for 10% of them. And so oftentimes that leads us to sort of question some of the systems or ways that we've always gone about doing things. And that helps us sort of think about becoming more trauma informed. I know Lisa had a question in here about how is this different than SEL, which is social emotional learning. I think that's what you mean, Lisa. And I would say that there are a lot of similarities across trauma-informed education and SEL. So there's definitely a component of trauma-informed education where we have to learn about social emotional development. It is a core component of our classes because we certainly believe that students need to have a diverse range of emotions and they need to know how to express those. And so oftentimes that's a core component of what we talk about in our classes. This is actually a specialty area of Mickey's. So Mickey, I'm wondering if you want to talk a little bit about social emotional learning and what that looks like in relation to trauma-informed education.
Yeah, I would say when we think about social emotional learning, we're talking for young children about relationships and looking at the environment that's responsive and quality. And we're looking at how do children manage anger and problem solve and develop friendships, all of those kind of skills that if we are putting things in place in our classroom that are supporting all children and then helping children who need some skill development, we might not have, say, challenging behavior. But when we take a trauma-informed lens, we're stepping back even further and saying, okay, this child, is having some meltdowns when he walks in the classroom. We're now going, what am I doing? Are there things I'm doing in my environment that might be agitating this child, that might be contributing to some of these behaviors? And we're looking at it through that kind of lens too. We're still doing things to support social emotional development and competence in children, but we're also understanding and taking the perspective that there are other things that could have contributed to this child's withdrawal, to this child's behavior, to the way this child engages with others or doesn't engage with others. So I would add that piece to it. Jessica, do you want to say anything else? You have expertise in this area too.
Yeah, I was very much taught about challenging behavior specifically, and in terms of thinking about antecedents and consequences and determining what the function of the challenging behavior is. And I still believe in that, but I also know, kind of like what Catherine and Mickey have already said, that there are other ways of understanding behavior, social emotional learning for people of all ages. And so I think this is, in our program, what we try to do is provide this really well-rounded perspective on trauma, social emotional learning, challenging behavior, and addressing and preventing challenging behavior. That is pulling from multiple perspectives rather than just one.
Thanks, Jessica.
I saw another comment in the chat about the effects of trauma on teachers and when they're working with students. And that is something that was covered in the program, is both in, I think we talked about it in the child development class and also in the trauma seminars, the impacts that working with students who have experienced trauma can have on you as a teacher, and then how you can help yourself. So we talked a lot about specific self-care strategies, and they were built into the class and into the assignments of ways to practice this and figure out like what type of self-care works for you best. And so that is something that is important and that is covered in the program.
Yeah, and I'll just add to that. Thank you, Mia. I think that's really important. I'll just add that I think one thing that we also need to recognize is that all of us as educators are also humans who have also potentially experienced trauma at some point in our lives. And we may or may not have dealt with that in some capacity. And so sometimes we will find that children in our classroom are triggering us in a way that we didn't anticipate because we haven't necessarily experienced our own, or we haven't examined our own experiences before. So we don't force people to examine their own trauma in our classes, but it certainly is encouraged for you to sort of reflect on your own practice, think about how your own upbringing or your own experiences come into the classroom to sort of interrogate some of those things. So you can feel supported as a teacher. Because I think sometimes we forget, we talk a lot about thinking about creating trauma-informed classrooms for kiddos, but it's also really important for us to think about what we're doing for teachers because they are going through a lot, especially right now. I saw another question about, Tara had a question. She works with students who have chronic and severe medical needs, and she wanted to know if this program looks into medical and birth trauma. Tara, that's a good question. That's definitely something that we would cover in the individual differences class. So we talk a lot about child development, which includes medical and birth trauma. I think that definitely would come up in the trauma seminar, and it definitely would come, you definitely could think about focusing in on that for the field study if that's your particular area of interest. I've seen a lot of people who have questions about tuition and costs. So I'm going to turn it, I thought I saw Sangeetha on here. Oh yeah, I see you now. Sangeetha, do you want to talk a little bit about costs?
Yes, that is a huge concern, isn't it? Or a consideration. So I saw Gina had great timing and she just posted some information in the chat. So we expect the tuition is going to be $500 per credit hour starting fall 2022. There may be additional fees, but this will give you a ballpark amount for what it would cost. And so again, as one of you pointed out earlier, you could take 12 to 14 credits. So depending on how many credits the student chooses, then that would be the amount of the program.
And one thing that I'd just like to point out that I did not point out earlier, but I think Gina put in the chat, is that this certificate can stack onto our master's program. So if you're kind of interested in this area and may want to go further and get a master's degree, these courses could count towards that.
Right. And that's a very important thing we want to make clear, is that that you can continue with a master's program. You can start and stop, so that's, you don't have to continue right away. You can finish the certificate and then circle back and apply for admission to a master's program. But we really wanted these certificates to be stackable.
Ooh, we have a question, Sangeetha, you might have to answer this. Sue wants to know, can cooperating teachers use tuition waivers for the certificate?
I don't know the answer to that question, but Sue, if you could email us, email Gina. She's the best person for questions about tuition waivers, and she has her email in this chat. So Gina Marie Poff, she can find out. Gina, I'm just volunteering you.
One other question I didn't see, but people may wonder, is why do we say 12 to 14 credit hours? So 12 is the minimum, and we have a 4-course seminar. The trauma seminar can run 4 semesters. It's 4 standalone seminars. We want you to take at least 2 of them, but you could take all 4 if you wanted to. So we kind of left that at the discretion of individual people, depending on cost, but your interest and how much you're able to do. So we welcome you to take all 4, but we didn't want to require all 4. And Mia did all 4 of them as part of her program, but we're leaving it flexible.
While others may be thinking of questions, I did want to at least take this brief pause to, Catherine, could I share my screen real quick? To let everyone know that we do have, everybody see my PowerPoint screen here for upcoming deadlines? Thanks. The registration for the Certificate of Specialization for non-degree seeking students opens on July 13th. You can register at this redirect link here. In a moment, I'll also show you how you can get to this registration page through our webpage. And current degree seeking students can register for the Certificate of Specialization now via the student self-service. If you have questions, you can reach us at the email address that is listed there at gradservices@education.illinois.edu. I'm going to then quickly want to share our program page. Everybody see our program page? You can get to our program page at education.illinois.edu/online. On the right side of the page here, you can see this Apply Now button. If you are a non-degree student, when you click on the Apply Now button, you want to then click on the Certificate of Specialization, and that will take you to this registration page where you can complete the registration process. And also, there is a redirect link that's a little shorter than the actual full URL that I have entered in the chat for everybody. So I just wanted to make sure that everybody knew about that and then saw that to see if there were any questions about registering for the Certificate of Specialization that once again opens on July 13th for non-degree students.
If I can volunteer you, Travis, now, since we're going to send the recording to everybody who registered for this event, so could we also send them this registration link in the body of the email so then they can have it there?
Yep, I will make sure that that is included in the message to everybody afterwards.
There were 2 questions I saw in the chat that I wanted to get to. One was about, does ISB recognize this certificate for anything? That's a great question. No, they do not. So at this time, they do not recognize it in any capacity. I would like to think that in the future, it might be recognized, but right now there's no recognition recognition for it. I will say that from Mia's experience and other graduates from the program, that when folks go out to interview for positions, it has been highly marketable for folks to have this kind of content. Administrators have been very excited about it. But again, I want to be really honest that it's not going to change your pay in that capacity. You know, it doesn't bump you up a level. We wish that was the case. So we'll keep you posted if that changes. Another question was about how long the program is. So right now it's designed to span across 4 semesters. So a fall, spring, fall, spring. And so you can take classes longer if you want to, you can try and take them shorter. It really depends upon sort of where you're at and what kind of time commitments you have. So we can sort of talk through that with you if you're interested and sort of thinking about how that might fit into your schedule. All the classes are offered online, so you will be able to participate from anywhere in the state. Trying to see if I missed your question, feel free to put it in the chat again, because I'm trying to keep track, but it keeps moving.
The only thing I'll add is about the 2-year sequence. One of the reasons we designed it as 2 years is like you would take the trauma seminar, potentially the first semester, individual differences is a spring class, and then the 2 field studies the second year. Hard to do a field study if you don't really have some content behind it. So that's our rationale for doing it that way.
Other questions folks might have?
Our emails were on one of those slides, right, Catherine? But there's some emails in the chat that you can contact Travis if you had questions, but ours are there too.
I did have a question. I'm sorry if this has already been addressed, but with the practicum experience, do you all discuss like what it might look like in out of school spaces or not? Because I know you said it doesn't have to be just a classroom. Can you talk about what that would look like for non-classroom spaces?
Yeah, that's a great question. So in all honesty, a lot of our students who have currently completed have been education focused. But some of our social workers don't necessarily go into school settings. So there's a lot of opportunity for folks to sort of design, specifically for the field study class, design a study that focuses on an area that's meaningful to them. So really, we just help folks sort of determine what the problem is that they want to study and how they might go about studying it. So there's really no requirement that it has to be with K-12 children or in a school setting. We're willing to work with you in any capacity. I would say most of our students currently have had an education focus and have focused on K-12 or early intervention. So birth to 12, grade 12. Jessica or Mickey or Mia, do you want to add anything to that?
Just that I can think of all kinds of questions where you may have existing data, like at the university where you want to study food insecurity for our students. And you're thinking, how are students accessing things they need, or some of the services on campus, or maybe colleagues that you have and you want to do more in-depth interviews around their attitudes about trauma, or what do they know? So I can imagine that there are lots of questions we have about what do people know about trauma-informed care and supports? What data do we have that we haven't really delved in and looked at it with that lens? We might be looking at it more strictly around social and emotional, but not going through with a trauma-informed support lens. So I think we could help brainstorm easily, given your interests or individuals' interests in this topic, and what do they have access to, and what's their context that they're working within right now.
Thank you.
I hope that helped. Did that help?
Yeah. Yes, very much so.
And I hope it's coming across that we try to be as flexible and individualized as possible. So if you have an interest, we want to help you follow that interest. And so if that is school-based or not school-based, we can make that happen. Lisa wants to know if we have suggested books to read more about trauma-informed care. We do, and actually, Lisa, maybe I can send a resource list to Travis that can go out in the email that you guys can access. We have Mia compiled this really great resource list that we share with folks that is all free resources, websites, TED Talks, just things that you can access for free that might be helpful. And that might give you a little glimpse of what you'd get much more in-depth information in the program, but that might help you figure out if this is a good match for you.
I also think it's such a new area in education and us all thinking about that it's ripe for people to do field studies and ask questions and be curious about. So we welcome you coming in with us with curiosities that we haven't thought about either.
Tara, thanks for that feedback. That's something that we can definitely think about.
So I see that we have a few minutes left, and I might be putting you on the spot here, but I do have some ideas on some of the masters this could stack into.
Are you asking me that, Sangeeta?
Oh, sure, Catherine, you can start.
I mean, I could pass it over to someone else. But I mean, certainly this could stack onto a master's in early childhood special ed and special education very easily. It's certainly in early childhood special ed. It stacks into our core content in our program. So that would be very easy to do. Sangeeta, you're probably more familiar with the C&I master's programs than I am, but I think this could probably work in some of the curriculum instruction programs as well. And I think there was a question in the chat about
EDD. Someone asked about the EDD, and I think it depends on what electives. So if the EDD program has electives, then some of these classes are certainly at the 400, they are at the 400 level or 500 level. So I think it's a matter of what's open in that program for electives, and then could this count as one of those electives?
There's a question here. Does the program pair well with a doctorate program? Elizabeth, I'm going to say it depends, which is a classic non-answer, but I think it really depends upon what program you're in. A lot of these courses can be taken in addition to your content in your doctoral program, but in terms of the timing and sequence, I'm not sure what program you're in. So there may be some conflicts in terms of the timing of classes and things like that, if that makes sense.
And I think I can speak for all of us when I say that we'd all be willing to, talk individually with anyone who's interested, but is not quite sure if it's a good fit for them or if it works, especially folks who are thinking about different degree programs. Because this is new, we really have to kind of figure that out together, but we're happy to talk with anyone to help you figure that out.
Any other questions we can answer for you all?
Yes, so I did see a question there. I will make sure to get the reading list from Catherine and include that there. There will also be a link to the recording, and I will also make sure to add the direct link for the registration for the certificate of specialization in there, with also a reminder that July 13th is when registration opens. So I'll make sure that all of that information is in the email that'll go out after the event, and that'll go out about 8 hours after the event to everybody. Any other last quick questions? Otherwise, we can wrap things up and give everybody back the rest of their time. If you have questions, obviously they all shared their emails here. Gina had shared her email in the chat. You can also get a hold of us at gradservices@education.illinois.edu. And we're happy to answer any of those questions. Also, the email that goes out after the event, if you respond to that email, we can also answer your questions that way. With that said, don't think I'm seeing any other last quick questions here. Want to thank everybody for joining us today. Lots of great questions. Thank you for the wonderful presentation, everyone. And I wish you all a great day.
Thank you. Thanks for hosting it, Travis.
Yeah, thanks so much, Travis and Sangeetha. We appreciate it.
Thank you. Thanks to everyone for attending.